Okay, so, oh, sorry. So with this chap of 83 years old with no other systemic disease, no diabetics, he had Fuchs endothelial dystrophy. He received a left eye uneventful DMEC in the past, and I performed a tripod procedure, so phaco IOL DMEC, that was uneventful. After 4 weeks, he came for a review. He was absolutely happy, 6/6 vision, unaided. The eye was quiet, no cells in the anterior chamber. But what we noted was like one or two KPs. They were quite large and white. So considering that the eye was absolutely quiet, what do you think was the diagnosis of this condition? So we have graft rejection, can be an post-surgery iritis because the patient had a cataract surgery as well, can be an infection or something else. Okay, infection. So infection is the most diagnosis, but the other 25% decide for a different answer. So we performed a confocal to these KPs to try to rule out if there were signs of infection. The confocal was negative. Considering no activity in the anterior chamber, we said, okay, let's try to increase a little bit the dexamethasone to 6 times per day, and we will see the patient again in 48 hours. So the patient came back, and we had a different pictures now of the patient. So the KPs were much bigger. We have a huge KPs or deposit superiorly, and we did an OCT as well. We repeated the confocal was again negative, but we had a lot of cells in the anterior chamber, and we can see also inferiorly this picture down on the right. So again, what's the diagnosis now? So a huge graft rejection, again an iritis or infection. I think that these 48 hours clear up also our idea. Okay, fantastic. We all agree. So clinically, despite the confocal was still negative, strong clinical suspicions of fungal infection. So what we have done was an anterior chamber tap for culture, PCR air staining. We removed the graft because we didn't want to sit and watch for other 48 hours or something more. We did intracameral injection of amphotericin because this is in our guidelines in Moorfields. And we sent also the DMEC. We did not only the tap, but also we cut the DMEC tissue in 2 halves, one for histology, one for microbiology. And the results of PCR was Candida albicans. The same day we started the treatment with natamycin because again this is our guidelines. If we don't know what kind of fungal infection it is, we start natamycin, but then as soon as we had the results for Candida, we changed the treatment for amphotericin hourly, chlorhexidine that has quite good antifungal effect. Also cyclosporin to reduce the inflammation and again has a little bit of antifungal effect, plus fluconazole 200 milligrams. Of course, we left the eye without the graft. The infection went a little bit worse in the first few days. And then we just continued the treatment, topical, systemical, and we had to repeat it week 2, another intracameral injection of amphotericin as soon as we discovered that was a Candida. So 6 weeks. And then at 3 months, the condition was stable, eye much less inflamed, no signs of persistent infection. Of course, corneal scar, despite was mild. After 12 weeks of systemic treatment of fluconazole and topical treatment, the eye was a little bit quieter. We stopped all the treatment after 4 months. So for 4 months, the patient had fluconazole orally plus drops plus everything, and the condition was quite stable. So what to do next? Do a PK because the corneal scar, doing a DSEC or doing a DMEC. I was expecting here one picture showing that the eye was quiet, but I don't know why it didn't come up. So I brought this case to the ground round at Moorfields because I was thinking, okay, let's do a PKA because there's a scar in the cornea. But all the other consultants, they said, look, the DMEC can be potentially very quick surgery because you have just to put inside to insert the graft, and then if you have bad results, you can always come back and do a PKA. So yeah, this is what I did. Sorry. So there were Synechiae, there were Synechiae that I had to release it to try to reduce the diameter of the pupil. The surgery was not so difficult, so I inject the graft and I open it. This was straightforward surgery, to be honest. You can see that there's, of course, corneal edema, corneal scar from 6 months of no descent. And it's fine. So basically, this is the results. After 6 months, the patient had unaided visual acuity of 618, was happy. He was keen not to having any further surgeries. The other eye vision is 6.5, and he said, no, I'm happy as I am, so don't do anything else. Thanks.